Friday, that we have had in writing a number of the issues that we raised, the specific departmental issues raised. We have had correspondence on some of them that have been positive to date, which I think is really important. I think shows a positive steps going forward in the GHA's attitude towards their staff. So that's positive. We obviously wait for the others to come through by the close of business Friday, and we'll obviously see what the responses are on the matters that we raised through nursing, industrials, AHPs and medical staff. And like I said, we'll wait and see what the other outcomes are. But so far we've had positive movements.
Now, as you mentioned, you've got dialogue going forward. You've got a number of scheduled meetings that you've mentioned. So what are you hoping to get out of those meetings, and how long do you expect to have to take before you can come to some sort of understanding?
Well, I think what we've established is a kind of a clear framework to tackle issues. It not necessarily is going to be the solution in of itself, but it presents the framework for clear and honest and open dialogue, which is essential to sort of constructive industrial relations for both sides. What we had prior to the Christmas break, when the Ministry of Health was more deeply involved within the Gibraltar Health Authority, was a complete stagnation and a complete kind of arrogance to not sit with the unions and to not progress issues. We had matters pending sometimes months, if not years, and we've been able to get responses on some claims within 2 weeks, which is what we want to see. We want to see issues progress in a positive way for both sides, because that's the way industrial relations should be done. It is about trying to get dialogue and move issues forward in both the interests of staff as their professional role, but also as their role towards patients as well. If you have staff that feel that they're being listened to and they're being acknowledged, they're going to be able to provide a better care towards the community. What we have with the forum is an opportunity where we sit regularly with the employers. We bring forward the reps take the leads in their areas and their departments to tackle the issues.
Now, finally, you've been doing a lot of work with the Director General on this and speaking to him quite closely. The introduction of a Director General was part of the GHA's Reset, Restart, Recover programme, one of the first things they've implemented in that programme. So how do you find having someone in the post of Director General is in regards to raising issues on United's part?
Well, I think what's important is no matter who goes into that role or how the organisation wishes to structure itself, it's important that from the union's point of view that we're listened to, that our members are listened to, and that we can take those issues forward to them.
And do you find that the introduction of this role has allowed you to have better communication with the GHA, or?
Well, so far, yes, but remember, we were very much, in terms of industrial relations, we were very much at a rock bottom just before Christmas in terms of dialogue. It was quite clear that management was essentially, senior management was essentially almost paralysed by ministry above in terms of being able to take decisions and being able to push things forward and even to say no on certain matters. That blockage, as far as we can see now, seems to be thawing away, but we're very much conscious that this is early days and we want to make sure that the positive start we've had on a few issues so far doesn't stop there. We have to keep going forward and making sure we do the best for our members.